One of the most exciting things about whatever you do in public health is the chance to impact so many people at a population level. The way that I got to this field of work was through medicine, and then I came to Johns Hopkins for medical residency and then infectious disease fellowship. I really owe my start in the field to D.A. Henderson, who had really been one of the world's leaders for so many years in eradicating smallpox. I could see that there were many ways I could contribute to that work and how a center here at Hopkins could really play a role in the world to try to help usefully shape our response to epidemics. Our preparedness continues to improve, and we're becoming more resilient with time. The center grew from a few people back in 1998 to about 35 people now. We are a center really comprised of many different kinds of talents. I think many of the problems in health security sometimes occur in the seams between medicine and technology, or between law and public health. And having people of different backgrounds helps us come at problems with the skill sets that we need to untangle them and to provide useful analysis and insights for the government. I was honored to work at HHS for the first year of the Biden-Harris administration as advisor to the Secretary on the COVID response. And at the end of that time, I was asked to move over to the White House to serve as a senior advisor on the COVID response team. That required a lot of interaction with media.
Joining me now is Dr. Tom Inglesby. He's the director at the Center for Health Security.
Dr. Tom Inglesby will testify about the pandemic before a House committee.
Now recognize Dr. Inglesby.
Thank you for the opportunity to speak with you, and I'm happy. Going on national television was challenging but very rewarding because I felt like there's a chance to speak to people about how things can get better. You know that you need to have your science right and have your public health principles set before the show. Learning how to effectively communicate as a public health expert without any kind of politics, but really just providing evidence and being clear about it is vitally important. Johns Hopkins School of Public Health does an incredible job preparing people for that work. Not only do you have leading thinkers and academics and researchers here, but you have people who are engaged in that work around the world. When I go to meetings around the world and I say I'm from the Bloomberg School of Public Health, people immediately recognize this school as an example of excellence in the field. I think you can see the impact of our work in the way that governments are organized, in the way that governments respond.
Every day, Dr. Inglesby and his colleagues are protecting us from urgent threats before us and from the future hazards that most of us have not yet thankfully imagined.
If you can help to change an intervention in the world that affects large groups of people in a way that helps improve their lives, what an honor, what an opportunity. And public health gives you the chance to do that.
He's made a profound impact on his field, and he continues to build a safer, healthier future for us all.
I'm Tom Inglesby, and I'm the director of the Center for Health Security at the Bloomberg School of Public Health.